All right, let's get right into it. For decades, the way drug companies reached you and your doctor followed a very specific script. Well, right now, that entire playbook is being completely torn up. We're living through a massive, fundamental shift in how medicine is marketed and delivered. It's a great unbundling that's going to change everything about your experience as a patient.
And I'm not talking about a small change here. To really put this in perspective, media strategist Eleanor Carey says, we haven't seen a disruption this huge since the late 1990s. Now, you might remember that. That's when the floodgates opened and those branded drug ads first started showing up on TV. What's happening right now? It's every bit as big a deal. So, before we can understand where we're going, we've got to take a quick look back at the old model that's now being totally dismantled. It was an era built around one single, really powerful tool, the 30-second TV ad. And for more than 20 years, the formula was just incredibly simple and, honestly, incredibly effective. You know the drill. An emotional ad, followed by that super fast-talking list of all the possible side effects. And boy, did it work. Brands that advertised on TV saw their revenues more than double in just 3 years. But that world is crumbling as digital takes over and, well, a perfect storm starts to brew. You see, the old system isn't just fading out gracefully, it's collapsing under the weight of some huge pressures all hitting at the exact same time. Let's break down what's really forcing this change. First up, the insane cost. For a lot of health insurers, spending on prescription drugs is expected to jump by more than 15% in 2025 alone. And a huge driver behind this, the explosive popularity of the new GLP-1 drugs for things like weight loss and diabetes. They are straining healthcare budgets to the absolute breaking point. Second, the system itself is just broken. And this number just perfectly illustrates how absurd it's gotten. Get this, a recent analysis found that a mind-boggling 92% of the negotiated prices that insurers publish are what they call ghost rates. These are prices for services that will literally never happen, like a dermatologist performing open heart surgery. It just shows you how inefficient the whole thing is. And third, there is a massive new legal risk. Just recently, Healthline Media had to pay out a $1.55 million settlement for breaking California's privacy laws. And what was the problem? These tiny little bits of code called tracking pixels on their website. They were sharing sensitive health data without anyone's consent. And that, understandably, sent a huge shockwave through the entire industry. So the really crucial thing to get here is that this isn't just one problem. It's all of them hitting at once. You've got tougher rules on ads, you've got intense political heat on drug prices, the budget-busting GLP-1s, those new privacy laws creating huge legal headaches, and, get this, on top of it all, marketing budgets are actually shrinking. The industry is basically trapped. They have no choice but to tear up that old script and write a brand new one. So how is pharma fighting back? Well, they're doing something pretty radical. They're building a direct line straight to you, the patient. They are trying to cut out that incredibly complicated system of middlemen that has defined healthcare for decades. This whole new approach is called direct-to-patient, or DTP. And believe me, this is way more than just a new website. We are talking about a complete overhaul. These are digital platforms built to handle the entire process, from getting a prescription, to managing payments, to getting your medication delivered right to your front door. And this is not some small niche experiment. I mean, just look at how fast this is happening. Eli Lilly kicked it off in early 2024. Pfizer jumped in just a few months later, and by 2025, a whole wave of the biggest names in the business, we're talking Novo Nordisk, AstraZeneca, Amgen, they all have their own platforms. This is a full-blown industry revolution, and it's happening right now. Now, the official mission, as this quote from a Lilly executive lays out, is to make your healthcare journey a whole lot smoother. It's about getting rid of the frustration and the roadblocks that make the system so darn hard to navigate, and instead connecting you directly to the care and the information you actually need. Okay, so having this new direct connection to patients means you have to completely rewrite the marketing playbook. That 30-second TV ad just doesn't cut it anymore. So pharma companies are being forced to get really creative and try out some entirely new tactics. This chart just lays it out perfectly. The goal isn't about checking a compliance box anymore. It's about being genuinely transparent. The main metric isn't just how many eyeballs you reached, it's how much people actually engaged. Instead of going through a maze of middlemen, the channel is now direct to you. And the focus has blown up from a single TV spot to supporting you through your entire health journey. So what does this actually look like in the real world? Well, instead of a classic drug ad, A company called Ionis Pharmaceuticals sponsored a documentary-style show to tell real stories about a rare disease. See, this isn't about selling a product. It's about building awareness and helping families find answers. And it reaches that specific audience in a way a generic TV ad never ever could. Here's another really smart tactic: putting the pharmacy in places you least expect through partnerships. For instance, an urgent care provider teamed up with Amazon Pharmacy. Think about that. It means you can get diagnosed and have your medicine delivered that same day, all in one seamless move. They're competing on pure speed and convenience by putting the pharmacy right into the doctor's office.
But, of course, this new digital world has a pretty serious dark side. Let's talk about that pixel problem. Here's how it works. You visit a web page, let's say it's about diabetes. A tracking pixel on that page can grab that information and your unique IP address and then send it off to a third party, like Meta or Google. This means what they think are your health interests can be shared, often without you clearly saying it's okay, creating those massive legal and privacy risks we talked about.
So, with all these huge changes, the good, the bad, and the risky, what does this actually mean for you? For your personal healthcare experience. How is the place you get your medicine actually going to change? Well, your local pharmacy is basically evolving into what experts are calling a care hub. The focus is shifting away from just counting pills to actually providing clinical services, like helping manage chronic conditions. AI is going to predict when you need a refill and get it for you automatically. Your pharmacy is going to be way more connected to your doctor's office. It's all moving toward a model of care that's more personal, more predictive, and ultimately driven by your data. And that, of course, brings us to the big final question. This great unbundling promises to give us more control, more convenience, and more direct access to our own healthcare. But at the same time, it means our data is being collected in all these new ways, and we're being marketed to more directly than ever before. So you have to ask, what does this all make us? Are we becoming truly empowered patients, or are we just becoming better targeted customers? That is the critical question we're all going to have to answer as this new playbook unfolds.